Hello, everyone. Good morning and happy last day of JNUC. Thank you for attending today. I'm going to point out real quick, if you would like live captioning or translations, you can scan the QR code over to the right of David. And today's session is Return of the JAWA, Shared Bedside Device Implementation in Healthcare. And our presenters today are Justin Fincher, System Engineers 3 at Children's of Alabama, and David Raabe. He is a Senior Professional Services Engineer at Jamf. Both of them will be available to hang in the room if you want to chat a little bit, but there will also be time for Q&A at the end.
Yeah.
Thank you.
Yeah, thank you. Good morning. So glad to be here and be able to talk to you guys this morning about this wonderful topic of shared bedside iPads and shared devices in a patient workflow. Again, my name is Justin Fincher. I'm with Children's of Alabama. I'm a systems engineer and a Jamf admin at Children's, and we're a 332-bed not-for-profit hospital in central Alabama. We serve kids from all over the state, surrounding states, and the nation. And I've been at Children's for 20 years now, and I've been everything from an audiovisual engineer, where I focused on telehealth, moved into surgery and managed all surgical technologies throughout all of our surgical suites, worked with our surgeons and nurses and stuff. So really kind of vast range of different IT and technical stuff. And of course today I'm a systems engineer managing multiple different technologies across the organization. But my focus is, of course, Apple deployment.
And I'm David Raabe. I'm a Senior Pro Services Engineer here at Jamf. I started out in the services field techs team doing jump starts and jump starts exclusively. Then I had the opportunity to start working on doing healthcare implementations, which led me to working with a whole bunch of different wonderful hospitals and started building new and exciting products and projects for them. And here we are.
Awesome. So I'm going to stand up because I'm a little more comfortable that way. So I want to talk about our goals and our learning objectives that we've got today. There we go. Sorry about that. So we're going to start off by identifying the challenges that we had with deploying shared bedside iPads and making sure that we did that securely and efficiently. We're going to explore all the integrations, all the Jamf software that we used and the products that we used to make all of this happen. We're then going to look at what that looks like at our deployment at Children's. And then we're going to kind of uncover everything and look at all of the smart grouping, how all the branding works and how this workflow works on the back end, and then we'll have some time for Q&A. All right, so this quote here, technology shouldn't be another task for nurses. It should be their ally. If it's not saving them seconds, it's stealing them. This is kind of the creed that I try to go by whenever we're deploying any kind of new technology, any new deployment at Children's, because let's face it, if you put a technology in front of nurses that they're going to have to use or they're going to have to deploy, and especially physicians, if you're going to put some technology there, if they're not on board and it's not saving them time and it's not an intuitive workflow, the project's going to die. The devices are going to sit in a cabinet. They're never going to get used. Their patients are never even going to get to see the device because they're not going to want to deploy it. So we had to make sure that technology was simple to deploy and it didn't take time away from the main thing, which was our patient care. So that's at the bottom of everything, and I'm sure for those of you that are in healthcare, you understand that 100%. So at Children's, we see technology as more than just a device. We see it as a way to keep patients connected, to keep them informed, and honestly a little more comfortable during their stay. And we knew that tools like Epic MyChart Bedside, having entertainment to transform that patient experience when they come into the room, it was something that we had to make sure that was in place, that they had a way to message their providers, that they had a way to check on their care plan and follow up, that there were telehealth services available in every room. We had to make sure all of these things were in place, and we knew that it helped when you added entertainment and games and stuff, especially for a children's hospital. It adds another layer of kind of that de-stressing and kind of a distraction technique with technology. So the reality was, though, is that bedside iPads were not going to be something that we were going to deploy at Children's. Our administration had other priorities. They didn't see the full value just yet. Money was already kind of allocated aside, and they just said, look, bedside iPads aren't going to happen. I do hope that one day we have bedside iPads, but the reality is even in our healthcare community this year at JNUC, there's even kind of talk of, is a one-to-one bedside iPad really where the future's going? When you have so many patients coming in with their own devices, what does that look like? And so, I don't know. I don't know where we'll be with that. I don't know if we'll end up with those bedside iPads or we'll continue down this shared environment. But that kind of brings me to the next point, which is we wanted to make sure that no matter the demographic or the means of a patient, no matter what kind of financial background that they have, you've got all kinds of range of people coming into the hospital to stay. You've got people that are bringing their own devices in, but you also have people that don't have the means to have their own device, or they don't have the technology themselves to be able to access their kids' MyChart, or don't understand it. So we wanted to be able to provide a solution for that. So what are some of the challenges? We knew that we had to deploy iPads on the clinical unit in some form or fashion, but it kind of had unique challenges with being a shared iPad for patients to use. And our goal was to create this frictionless workflow that was secure, that was repeatable, and it was seamless enough to fit into our nurses' routines every day. So security was really the first piece of this puzzle. We went, okay, how are we going to make sure that, when this iPad is deployed in the room or on the units, how can we make sure it's all secure? Because let's face it, a personal iPad that a patient's bringing from home, it's simple. It's one person's device. You don't have to worry about it. But when you're looking at deploying a device that could be hundreds or thousands of people's devices over its lifetime, we had to make sure that we were securing these devices when they weren't in use. We had to make sure that they were just this blank, clean slate with no access into our hospital network, and it wasn't just sitting around like that. The next thing was the nurse's workflow. Look, the nurses are busy. You guys know that they're managing medication schedules, they're charting, they're doing hundreds of other things during a shift, and we had to make sure that this process was fast and error-free for them. And then finally is our patient privacy, and this is probably the most important thing, and you guys that are in healthcare, you understand this. Managing and making sure that patients' data is secure is not just a best practice, it's the law, and we've got to make sure that that's happening, and it's happening every time. We've got to make sure that when this device wasn't used, it had to be in a state that the nurse knew that it wasn't in a patient's hands, or that when it moved from one patient's hands to another patient's hands, that it was completely wiped, and we had to be able to trust that process. So with this, our challenge was clear, and what we had to move forward to was absolutely clear. How do we make the deployment of a dedicated bedside iPad in a world that we are not deploying dedicated bedside iPads, but make it feel the same way? And so how do we kind of pull this off, and what was our logic behind it? It was having the right tools in place and using them in the right way. And so first, Jamf Pro. Right? This is the foundation of everything that we're doing. If this is the engine, everything else is going to be built around this. So this was our baseline. Then we moved to our JAWA server, the Jamf Automation and Webhook Assistant. So this is the piece that I remember in 2023. Walter, I'm glad you walked in. But Walter gave a talk in 2023 with Chris about JAWA and how they use that for iOS and iPadOS naming. And I knew at that point, we've got to get this. Well, this is something that I really struggle with, making sure our devices stayed named correctly, even when we completely wipe devices. But then I found out about Brander, and how Brander could produce these wallpapers and QR codes and print device information on the wallpaper. That was the last straw. I was like, I love this. We've got to get it embedded at Children's. And then last year at JNUC, Jamf Mobile Assist, Adam Derrick did a presentation on this. And This honestly was the puzzle piece that was missing, and this was the game changer in this workflow that we deployed. This right here, when I saw it, I was like, you know what? This is a really cool app, but I really didn't understand how I was going to use it. All of our desktop techs had access to Jamf and their security groups. And so I knew that they really weren't going to get use out of it. But when this project of having shared bedside devices, it clicked. And it was like, this is the piece that's going to create this workflow that's going to do exactly what we need. And it's going to be that catalyst to kick it all off. And then, of course, finally, we've got Healthcare Listener. When using Healthcare Listener and it triggering these wipes and this digital sanitation used alongside with return to service, this gave us the technology to make sure that every iPad was safe when it reached the hands of the next patient. And so all the technology is going to do all the heavy lifting, but moving between smart groups and unhiding apps and doing all this was in place. Jamf had all these tools already sitting at our fingertips ready to be used. And so for the nurse, this created this seamless workflow that wasn't complicated, but they were able to just make it work simple. So that was the big picture. That was a lot, kind of how we got to where we were at, kind of the what and the why. But now I want to look at kind of how we made this happen, and then we'll give you some real world and show you this in actual workflow. So what happens is when a device is slated for this program, for this shared bedside device program, we had to be very intentional in making sure that these tools to create this effortless workflow. And so when we started, we created this foundation smart group called Has My Chart Bedside. And so what this does is it gives us the ability that when we take this extension attribute called My Chart Bedside Device and we set that to enable, we filter all these devices into a smart group called Has My Chart Bedside. And so what this does, it does two things. First, it gives us a master inventory of all the devices that have been slated for this program. And the second thing that it does is it acts as this deployment anchor. So all the apps that we're going to deploy, all the apps like My Chart Bedside, Return to Service, the games, the entertainment, you name it, it's all getting added to the device at this very moment that we slate it for this program, right from the beginning. But then we're going to take it a step further, and so once devices are flagged for this program, it reaches this unassigned state. So what this unassigned state does is it has to be a member of that Has My Chart Bedside, and then our room is set to unassigned. So this is in the user locations field under the device, and the unassigned state is the default state whenever an iPad is wiped. So it's always coming back to that exact state that we want it. But then we wanted to make sure that there was another layer of security here, and then we also made sure that it was not already a part of the assigned group. So this way we made sure that it's in the state that we want it to be in. And then again, I said earlier, at this unassigned state, we're sending all the same apps to that same smart group, so the apps exist along every step of this process. So this is where JAWA kind of kicks in and this brander starts to shine. In this unassigned state, we very deliberately push down this ugly wallpaper. I mean, this is bright. It's more than just a red flag, but we wanted to make sure at a glance that any of the nurses that pick up one of these devices, immediately they know the state that it's in. And we also wanted to make sure that we had clear instructions. So even if a nurse wasn't familiar with the process, easily they can look at this device and we go, okay, this device isn't assigned to a patient, but look, there's that pretty little icon of that Mobile Assist app. Hey, I know that app. It's on my clinical smartphone. So now we have steps to make sure that they understand what their next steps are. And again, all the apps are hidden in this state, and there is no app there deployed. This is that user and location information where that room is set unassigned. So we've covered all the bases. We've talked about the staging and how Jamf is used and all the apps down the line, but now we want to talk about exactly what that workflow looks like. You probably already have some idea, but we're going to walk through it. You have something? Good?
Yeah.
All right. So the nurse starts off by accessing their Mobile Assist app on their clinical smartphone. They scan that QR code that's on the iPad, and this triggers that room assignment and the user's location field to be changed from unassigned to a room number. And then we filter that into a smart group called My Bed Chart Assigned. And so now the device is a part of that unassigned group, shifts into that assigned group, gets that configuration automatically in the background, and then all of this happens seamlessly. This is super simple. Honestly, the nurse can just walk into the patient's room as she's walking down the hallway getting this done, and it's a seamless workflow. So what I want to do now is I just kind of want to walk you through that process. It's really simple, really intuitive. Over here on the right-hand side, you'll see the nurse's iPhone. This is their phone that they check out every day. They simply choose assign location, scan device. They're going to scan the iPad QR code, scan the room, and these are just wall clings that we've placed in each of the patient rooms with that room number. They'll scan that QR code, confirm, and then at that point immediately all of the processes that are happening, Brander's rebranding the wallpaper, changing information, and if you'll notice at the bottom, all of this information, all of that device information is very important. This is dynamically getting assigned with JAWA. They're reading in Jamf Pro and placing this information directly baked in on the wallpaper. So we've got device name, we've got the department that this device belongs to, serial number, just because why wouldn't we put the serial number there? And then the biggest one there is you'll notice that we've changed that unassigned state information to the actual room number. So now we know which room and which patient this iPad actually is assigned to and belongs to. So that's all cool, but I want to show you in real time because I think that's one of the best things about it. So this video is that same process. We've got our nurse's iPhone over here, and this is going to go real time. Going to open that Mobile Assist, click Assign Location, scan the QR code, scan the room. I had to have dramatic pause effect in there as I was trying to find that QR code. And boom, apps are unhidden, apps are deployed, Brander's rebranding that wallpaper and changes. And this is real time happening with the nurses. So we've ended up with this cool workflow that makes sure that every patient gets the same thing every time. And so this is just the config profiles that we're using. We've got 4 different ones. We've got the unassigned state, content restrictions. We wanted to make sure we still had Safari available with the websites that we want them to have access to. And of course, they've got to have access to our hospital's website, right? And then we're doing a home screen layout. We want to make sure that every patient that gets a device, they're all the same. And that it's just a continuous workflow across the deployment. And then simply unassigned state and assigned state. Unassigned, hiding the apps. Assigned is unhiding those apps that we want them to see. So yeah, so that's kind of the workflow. And I'm going to pass it over to David where he's going to talk about Brander and JAWA and all the other fun stuff.
I'm not going to stand because we're on day 3. So Brander is a Python workflow that runs under JAWA to generate bespoke wallpapers per unique devices. We can put specific device information on there, as you've seen, a QR code. We can use different wallpaper for different use cases with the one workflow, and put things where we want. It's really pretty dynamic as far as that's concerned. We can see that we've got the difference between old and new. All of the device information on there. There's a lot of different fields that we can set for the device information. These are the ones that are default available, but realistically anything can be used if it's an attribute in Jamf Pro. If we can pull it from the API, we can put it on the wallpaper. These are ones that I've got pre-built that are ready to go with no actual extra effort. Piece of cake. All right, I pushed the button, I swear. All right, no, I did not. This is what the JAWA dashboard looks like. Now, JAWA is just a webhook and automation server. It's just a little Flask Python applet in there. We out of the box, we can pull Webhook's information from Jamf Pro, Okta, and we can also do timed automations, also known as cron jobs. So if we want to have something where we're pushing something out at a specific time, or maybe doing like, oh hey, let's do a device reset on this set of devices because nurses forget to log out of their iPads at night and there's nobody at a certain area at a certain time of day. We can say, okay, well, we're going to target this group and we're just going to wipe all those devices at 9 o'clock or at midnight so that when nurses come back in at 8 in the morning, we don't have to worry about whether or not somebody's logged into that device and that device is logged out. Here are the Jamf Pro webhooks that we're using. Webhooks that are created in JAWA. If we're using the Jamf event of the Smart Group mobile device membership change, will be disabled by default. When we hit save, because we're logging in with Jamf Pro credentials, it will create that webhook in Jamf Pro. And again, if it's using the Smart Group mobile device or Smart Group computer membership change event, it'll disable it by default so it doesn't happen automatically without you selecting a group. Also, if you do an update, it will make a change at that point as well. You'll notice that we're using camel case for the name and the webhook, and that's because JAWA doesn't really like spaces in the name and causes problems with that. I got off track. Give me a second to catch up. I said things in the wrong order. We give it descriptions because we're not always going to have our names be as descriptive as possible. This way we can see it and know what it is. And when we're not field limited by text quantity, it's easier to be more verbose and give an actual descriptive description. And when we upload our script, typically speaking, we're using Bash or Python, but realistically, any interpreter that the Linux server that we're running on will support will be sufficient as long as the JAWA user can support that. And we support authenticated webhooks, or you can do unauthenticated webhooks. I'm always a big fan of authenticated because then it just keeps somebody from randomly hitting your webhook server with some information. And then once we save it, we're notified and we can go back into Jamf Pro, turn it on, and select the group that we're enabling it for. I don't remember that being there. We support uploading files into JAWA. This is how we get our lock screen templates in place. In this case, we've got quite a few templates for various different use cases. Now, the default JAWA has a pretty low support limit as far as file size is concerned, but that can be increased in the settings so that we can upload as much as we want. When we upload the specific file, the brander script just has to know what the name of the file that it's pointing to is, and all's said and good. I'm really bad at pushing this button. And here we can see the logs that JAWA gives us. Any log for any script that is being run by JAWA will get outputted into the JAWA logs. And so we can be as verbose or as quiet, silent as we want. I like verbosity because then I know what's going on. And so here we can see that it's pulling in different pieces of device information. It's generating the text in the appropriate spots. It's building the image. And then finally, it sends that wallpaper to Jamf Pro to be deployed to the device through API. And then we can tell that Jamf Pro has accepted our command and said, hey, yeah, I'll do the thing. And now that we've successfully deployed a shared iPad to a patient, the next critical step is figuring out how we return that device to a clean state. And in healthcare, this is really not optional. If an iPad leaves the hands of one patient and goes straight to another, without being digitally sanitized, we risk exposing protected health information or their Netflix account.
Yeah, and we've actually had that happen. Well, not that specifically, but we have a sunshine school, we have teachers that are keeping kids keeping their education up to level while they're stuck in the hospital for an extended period of time. And one of the issues that we had, we deployed iPad Pros with keyboards to all of those students, and they're using Google Classroom because most of their schools use Google Classroom. And Google loves to hold on to usernames. And so these teachers were passing these iPads over from one patient to the next, and email addresses were popping up. And I was like, whoa, this is a big red flag. So we deployed Reset back in the day and walked our teachers through how to hit reset and go through all the setup steps and get back to the state that they need to be in. But what we're about to talk about here was healthcare listener in return to service. Return to service was a game changer for them. And I wished you could have seen their faces, how excited they were when they just hit the button and it's back ready to go in just a matter of time. So it's extremely important. Digital sanitation, wiping, resetting devices, it's essential. And we had to build 2 different workflows here to make sure that was happening correctly. Because we had 2 kind of different use cases being shared iPads.
Yeah, do you want to?
Yeah, so I mean, the cool thing about, go ahead, let me advance that. I've got to show my fun, Chat GPT images that we created to fit this need. But healthcare listener, of course, connects to the EMR to Jamf Pro using HL7 messages. Listens for those patient events, admission, transfer, discharge, and there's a long list now that's available and even more stuff that it'll do.
Full spec, I believe.
Full spec, a lot of stuff, yeah. So this is if you haven't experienced return to service, it's a full reset. Wipe hangs onto the Wi-Fi. There's even some new cool stuff to where there's partitions and hangs on to bundle IDs and things like that. So it's just a great app, and it's just super simple and intuitive for our nurses as well. So here's what that config looks like. David, you want to talk through any of that?
Yeah, absolutely. The healthcare listener it's just a Jamf infrastructure manager that listens to your HL7 EMR, your EMR's HL7 interface. And we install it on a Windows or a Linux server. It extracts the specified location value from the ADT message, from the PV1 message of that ADT message, typically PV133 or 163, but realistically it can be anything if our interface teams are particular about where they want that location field to be. And then it just sends that information up to Jamf Pro, which matches the value in the attribute that in the rule that we have created here. As we can see, we're doing PV133 and 163, and our inventory field is room on the user and location. But it can also be an extension attribute if we're using room, or maybe we're clearing user and location information, so we need to jump to an extension attribute.
Yeah, so this is simple and intuitive. I mean, patient gets discharged. It's an automation that happens without anybody. No IT tickets, no nurse having to go into the room after the device is wiped, setting it up. It just all ends up right back into that default state. And our default state with the shared iPad deployment is that red wallpaper that I showed you earlier with no apps deployed. And so it's just super simple, super easy, and intuitive. But we had a little bit different use case with being a shared iPad. We kind of had to make sure that we provided a different workflow because the patient may not have the device all the way to when they're discharged. They may be done with the device, they're still a patient, and they're going to be there for another few days, weeks, months, whatever. And another patient needs to have the device. Well, they're not being discharged, so it's not going to get that automatic wipe, but we had to make sure that there was a secondary way to do it. And so this puts it back into the nurse's hands, using the same app that they use to deploy the iPad to the patient. But this time, as you'll notice, instead of assigning a location, they're going to choose return to service within that Mobile Assist app. So the nurse uses that app, scans the QR code of the iPad, confirms that they want to wipe and return it to service, and done. Easy. I mean, I've said this already, but it's about the simple way to do things for our nurses and making sure that we're offering these simple tools that are taking care of everything in the background, but it's simple and intuitive and easy for those nurses to deploy, because now it's going to get used. They're going to offer it to the patient. Do you want an iPad? Sure. I know it's an easy workflow and it's not going to take much out of my day. Same thing here. They're not going to mind wiping a device if they're going to pass it over to another patient because it's an easy, simple, intuitive workflow. This is a video showing the same thing. I'm going to skip through this. Not much different. But yeah, David, anything else on anything that we've talked about?
It's really easy to set up and really easy to do as an admin. Justin and I worked on this together as part of a healthcare listener pro services engagement, and I'm sure I recognize a few faces in here, so I know we've done some of this work together as well. So, but if it is something that your hospital's looking for, please come see me after the talk, and we can talk about what pro services can do for you to help you get something like this, or what maybe your custom needs are.
Yeah.
Because Justin came to me with, I have a custom need. I've seen some tools. How can we make this work? And I think we did a good job.
Yeah. No, and it's such a simple thing. It's not some mind-blowing new technology, but it's using all of the Jamf tools that we've had in place. Jamf Pro, JAWA, Mobile Assist, Healthcare Listener with Return to Service. All of these tools being used in a strategic way to make this workflow easy. With that, I mean, this is something, if you've been in Jamf in any amount of time, you know this application. But if for some reason, I wanted to put it in here because I use it daily. If you don't know this app, get it. Mass update tool. It changes lives alone by itself. That one app.
Also in your Jamf app catalog.
Yeah. Mm-hmm.
So you can just plug it into Jamf Pro and send it to yourself.
Yeah, and so I want to end today with this quote from the one and only Steve Jobs. Technology alone is not enough. It's technology married with liberal arts, married with humanities that yield us the result that make our hearts sing. We're all in healthcare, and we're all Apple fan boys and girls, right? I mean, there may be one or two Android users in here, and we'll shame you after. But look, we've got this technology, and when we get excited about it, right? An iPhone, new iPad, new MacBook Pro, that alone just speaks to us somehow, and it just gets us excited. But it's so much more than just this raw technology. When you're able to take this technology and you're able to use it in a way that affects patient care, that affects how patient care is delivered from the nurse's perspective or physician's perspective, that's what makes it powerful. And I think that's what Jobs was saying here, is like, look, raw technology is awesome, but when we put the human need and the human workflow in there, that's where it changes. And I think that's why we all sit in this room, and I think we all have a heart, especially for those of us that are in healthcare, probably even more. I'm just going to say from my own personal experience, but those that are in a pediatric platform, the heart of what we're doing is more than just technology. It has a lot more meaning down the line. And so that's why I got up here today. That's why I wanted to share this workflow with David. But with that, we're done. Thank you guys so much. And we've got about 10 to 11 minutes for any questions or any of that. We'll open it up. I think we did a good job explaining it, apparently.
Sure seems like it. I mean, I can't tell if anybody's hands are raised because I'm blind.
It's bright up
by
there.
this light, but yeah.
Walter?
I probably missed it. When a patient discharges, the room goes back to unassigned.
Yes. Yep, that is the default state.
Except after you clear it,
Yeah.
it goes back to unassigned state.
Yep. Yeah, so that
clears
extension.
the room. There's a healthcare listener rule that we didn't show you that clears the extension attribute.
Yeah.
After. Yeah.
Yeah, and so that extension attribute of being part of the MyChart Bedside program stays enabled. That's such a powerful tool to be able to wipe an iPad and hang on to those extension attributes. I've kind of become an extension attribute fanboy. Those things are, they're powerful. So if you're not using extension attributes, definitely try it.
The thing that everybody asks me is, well, what can people use extension attributes for? And it's anything you can think of that Jamf Pro hasn't thought of already first.
Yeah.
And the main value of extension attributes is that Jamf Pro can't know every need that you have and having the ability to just dynamically create an attribute for Dave's awesome attribute, yes or no, and being able to put that in because it matters in your environment. Or I have an app, I need to know if this app exists or not, or should exist or not. You can build that.
Yeah, we use extension attribute for the device name. Holding on to the way we name our devices in the hospital is it was just forced JAWA name. And we set that device and we use MUT to push all that up to Jamf when we're deploying a large number of iPads. And now anytime that iPad is wiped, the device name is there. And then JAWA takes that and prints that to the device name and gets rid of the serial number. And so now we have a very clear, easy way to search. Because if you've ever had to talk with a customer, you're like, all right, well, what's your serial number? And then having to have them either send it to you or read it off, and they type it wrong.
Yep.
The iPad name and what your naming scheme looks like, it's powerful to have that extension attribute set.
Absolutely.
Any other questions? Yes.
This being really basic, I'm asking only from like a nursing perspective.
Mm-hmm.
Because I'm not the IT person here, but I saw that you had settings available for the patient to look at. What would the nurse or the patient need to access the settings?
Well, settings, you can't hide settings.
You can't hide settings, so you can't prevent it from being visible. So it's not about what the value is to the patient or to the nurse. Potentially there are reasons that they could want to affect change on some of these devices because realistically the device is theirs until we nuke it from orbit, right? So what they do with it, if we give them the ability to set a passcode, some hospitals do, some hospitals don't, so that patients can protect their own data. And those things aren't necessarily done automatically. We give them the option, but we don't enforce that. Some places have different needs and desires, but having the ability to go into settings for a patient could be changing languages or accessibility settings. There are good reasons that Apple prevents us from hiding that. Does that necessarily mean that we don't wish that we could sometimes? Yeah. But there's not a specific, we did this because we wanted access to this thing. It's we did this because we can't stop it, but there are good reasons for that.
I mean, think about it like this. You hide settings, and let's say it drops Wi-Fi. How are you going to get it on Wi-Fi? You've got to be able, our default is our guest network, which isn't a password-protected network. So if we ever lose Wi-Fi or something happens, you choose guest, and we're able to get configs back to that device. And so, and a lot of the things that are in settings, you can lock down through config profile, and you can say, don't allow this. Don't allow Wi-Fi to be turned off. Don't allow this or that. Don't allow a wide range of things that you can limit, even though settings app is still there. All right, anything else? Yes?
You talked about how to get the device back to ready, unassigned.
Right.
Besides the two, either discharge or somebody takes the app and sends it back to unassigned. Do you have any other workflows for the IT team to mass reset devices at one time, or anything else that maybe like some secret tips and tricks for your team you have there, or are those the two main approaches?
Those are the two main approaches. We, of course, can wipe those remotely in Jamf Pro if we needed to. And that's going to, because it's smart groups and not static groups. I used to use nothing but static groups early on. And when I really dove into them, oh my gosh, it changed my life. The amount of times that we would wipe a device and then the user's like, well, it doesn't look the same. I got all the apps. I've got the App Store on here now. I'm like, oh.
Now, what Justin has forgotten is that because we are using the Return to Service app and we have set it up with the healthcare listener workflow, that we do have the ability to do a mass action to clear the extension attribute to perform a mass wipe.
That's right.
on those devices.
Yes.
So we actually do have the workflow in place. He just doesn't need it.
Yeah.
So
I've never used it.
he's never used it because it just works.
Yeah, it
and
does.
it's never had the need to.
And here's what's crazy. One thing I forgot to mention during the talk was we're still in a pilot phase for this. We've got 2 full units that have 20 devices that they're using for this workflow. We've been doing it for a year. The reason we haven't continued moving on, we're doing welcome, Epic Welcome for those of you that are Epic houses. We're rolling out like 500 iPads right now to multiple units, private practices, you name it. So we've really kind of got held up there. There's not been one IT ticket regarding the shared workflow. Not one. And so I think that alone speaks to your question. We haven't had to do anything with it.
And additionally, as JAWA has the ability to set up timed automations. So if we were like, okay, again, midnight, we're gonna just nuke these devices, reset them back to factory, and have them be set up, ready to go, we could have that workflow in place with JAWA, as if we were doing it on a daily, a weekly, or monthly basis. I have a customer who uses Crestron devices, and they need to be reset at specific intervals. Otherwise, weird stuff happens. And we were building out a workflow where when a device got a healthcare listener discharge message, that it would then check the age of the last time that we reset a Crestron device in that room and send a remote command through scripting to reboot that Crestron device. And we're in the early phases. We're in the early phases. It's apparently a lot of work to set up authentication on a Crestron device. So we're working on that. But that's the sort of thing like you can do all sorts of other timed automations with JAWA. And if you don't want to have to be there and babysit it, but manual push, yeah, absolutely, we can do that with return to service as well. Yeah. Any other questions before they kick us out of here?
Awesome.
Awesome.
Well, thank you guys so much for being here. So hope you enjoy the rest of your week.
Appreciate it.